Incisional care is very important, but also very simple. The biggest thing after your pet surgery is just to make sure that your dog or cat does not lick at the incision. There are millions of bacteria living in the mouth, and it doesn't have to be that pet's mouth. It can be any pet in the house. We want to make sure that none of that saliva and bacteria get into the incisional area. Once your pet has surgery, we do not want to get that incision wet. So until your vet has done that initial recheck at 10 to 14 days to evaluate and let you know that skin is healed, there's no bathing, there's no swimming. Normally, you are going to see some bruising and some swelling at the incision site. Just think about a bruise on your own arm. As you know, the bruise gets darker as you start to feel better. So over a few days, you may see that the skin will start to get a little bit more purple and darken and then eventually go away. That is completely normal. Also, some swelling, a mild amount of swelling is normal. What would not be normal is if the incision was starting to open, if you notice fluid coming from the incision, which would be bloody, would smell bad, might look like pus. None of those things would make me happy and may be an indication of an infection. So if you note any of those things, it's very important that you contact your vet so that your pet can be seen and make sure that we don't need any additional intervention or medications. It is very normal to see some ankle swelling right after a knee surgery. The reason why that happens is because the swelling from the knee will move in a gravity-dependent fashion down to the ankle, and that's okay. It typically appears about 3 days after your knee surgery, and all you need to do is do a little massage and warm compress, and that will allow the swelling to be reabsorbed and go away. But it is not painful and not a concern. Do not apply any ointments, hydrogen peroxide, or any sprays to your pet's incision unless you have specifically been prescribed something by your family veterinarian. I would recommend that you look at your incision morning and evening just to make sure that everything is healing as it should be. Typically, incisions are going to heal in 10 to 14 days, and that's when you're going to see your vet back for your first recheck to make sure that your surgical progress is going as it should and that the skin is healed.